So I want to just set the table here for a minute. Earlier this summer, I sat in a health subcommittee listening to Secretary of Health and Human Services, Robert Kennedy Jr. tout the administration's proposed budget and how it would make America healthy again. Just as the largest cuts to Medicaid and SNAP programs in American history was winding its way through Congress. In the big ugly bill, as I call it. And why were these cuts proposed? To fund permanent tax breaks for billionaires. And as I listened to the secretary, I could see a clear disconnect between what he said his and my Republican colleagues' goals were and what their policies are actually going to do. The big ugly bill passed at a time when a majority of Virginians are focused on the high and rising cost of living, made worse by the president's tariff proposals. More and more Americans worry about how they're going to afford to put food on the table, access health care, pay utility bills, and housing costs as the cost of everything increases. I've heard it every day since being on August recess, whether I'm here in Richmond, in the Tri-Cities, or in the rural counties between here and the North Carolina border. People want their leaders to find ways to lower their monthly costs. But this administration and my colleagues on the other side of the aisle did the exact opposite. And people are already struggling to get by, and the big ugly law will force millions to spend more for food and health care or be forced to go without. And this will not make them healthy. And absent congressional action by the end of this year, health insurance in Virginia for those who purchase out of the exchange will skyrocket as well, leading to the CBO estimates somewhere between 14 and 17 million Americans losing their health insurance. That's not going to make them healthy. And as more and more people go uninsured, their health care costs will go up for everybody. That will not make them healthy. And when it comes to SNAP, more than 34,000 households in the 4th Congressional District count on this program to feed themselves and their families. In Petersburg and Emporia, sadly more than 30% of the population is enrolled in SNAP. And our local grocery stores, particularly those in food deserts, rely on this program to stay afloat as well. And I want to thank Mr. Houston for being here today to represent the market at 25th here in Richmond. But this is not just an issue that impacts Richmond. As I saw when I visited the only grocery store in Surrey County, Surrey Market, where if they close, people will have to drive at least 30 miles to get fresh food. And yet the Surrey Market, while only 10% of their income comes from SNAP benefits, that income helps them buy in bulk fresh produce and meat that they know they can sell. SNAP not only keeps food on the table, but as you heard, it helps keep our children healthy in the long term. A study published this year found that SNAP helps protect kids from developing heart disease. And rather than making America healthy again, this historic cut to SNAP will do just the opposite. The bill also eliminated funding for the SNAP Ed program at the end of the month. The SNAP Ed program is what is used to help fund education programs for children and seniors to help them learn healthy eating habits. Last year alone, more than 21,000 children in Virginia were able to get this critical nutrition information through the program, and as a result, those children reported eating more vegetables and being more physically active. And with the program ending, fewer kids will get the information they need to live healthier lives. You've heard how SNAP eligibility determines eligibility for free and reduced lunch. It also determines how many school divisions are eligible for funding to help them provide free and reduced lunch to all children in those school divisions. They are in those Title I schools, like in Henrico County and in Chesterfield. The cuts to the SNAP program will trickle through, to school nutrition programs, making children less healthier, but you cannot learn if you are hungry. Ask any teacher, they will tell you. They can tell which ones come hungry and ready, and which ones come ready to learn. And while it's easy for my Republican colleagues to pass the buck and expect states to pick up the difference, I know from firsthand experience, and I'm sure you've already heard from Senator Hashmi, that's easier said than done. States have to pass balanced budgets every year, and this big, ugly law is currently set to shift $352 million a year from cost to Virginia once it is in full effect. That is $352 million that the Commonwealth of Virginia has to pay just for the cuts in the big ugly bill, on top of filling in the gaps from cuts to federal funding through grants, while it deals with higher unemployment and therefore less income coming into the state due to cuts to the federal workforce. Now this is money that the General Assembly is going to have to find to fill this hole that could be going to our public schools. It could be going towards lowering the cost of childcare. But instead, my former colleagues and the next governor will have to find the money to pay for these new costs or make the incredibly difficult decision to cut benefits or raise taxes. And this whole situation was avoidable. The cuts that Donald Trump, Mike Johnson, and John Thune have made to SNAP, Medicaid, and the Affordable Care Act are deeply unpopular. So much so that even Republican Senator Josh Hawley has introduced legislation to reverse the cuts to Medicaid shortly after voting to make those cuts in the first place. So to all of the advocates here today and everyone listening and watching online, I want to send a very clear message. I will not stop fighting for SNAP. I will not stop fighting for Medicaid. I will not stop fighting for you. And I have signed on to legislation to reverse these cuts as well. Your advocacy is working. Keep it up. Because the more people find out what's in this big ugly bill, the less popular it gets. And the less popular it gets, and the more pressure you put on my colleagues, the more likely they are to reverse these damaging cuts before they do too much damage for us to fix. Thank you very much.